Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified about 30 or 40 times on the screen. You can see the red cannula coming in. Just for a little bit of orientation, to the left of that red cannula, that's the superior border of the subscapularis tendon. And then crossing that is usually the middle glenohumeral ligament right here. There's a little bit of tissue in our face, but right there. To the right of that red cannula is the long head of the biceps tendon right here. That's one of the culprits that we're going to be dealing with today. And then above that is the rotator cuff, and the rotator cuff looks great. That's one of the main reasons we wanted to have a look inside the joint. So we'll take a pair of arthroscopic scissors and get this biceps released right away. Hold the camera here for a second, please. There you can see we've got a little bit more to cut. Okay, and now it's released. And so it's a little bit of a fold there. Hand me this, please. We're going to use an instrument called just a shaver to get rid of some of the soft tissue that you see there. Okay, pause. Okay, so now we're looking at the rest of the joint. This is the glenoid down below, and there's really no signs of any arthritis. That's good. Here's the back of the joint, looks good. A little bit of an air bubble, but that's gone now. The articular cartilage on the humeral head also looks pretty good, so I don't think there's anything else to worry about inside the joint. Okay, so this yellow bone you see at the top of the screen, that's the acromion, and that's the roof of the shoulder, and we've just been thinning that down a little bit just to take some of the pressure off the rotator cuff there. So hopefully you won't have any more problems or impingement type symptoms. I think we're done with that. We'll go ahead and put the shaver back on here and have a look around the rest of this space just to make sure there's nothing on this side of the rotator cuff to worry about. Okay, so we're pretty much done with the arthroscopic portion of the case. We're going to look down here. This is the kind of the superior border of the rotator cuff. As we rotate your shoulder, you can see that move. When we externally rotate, we can see the front of the cuff, and that looks great. Then we internally rotate, and we see the back, and that looks good all the way around. So no problems with the rotator cuff. So we're going to finish up here. We're going to do the rest of the surgery through that little 1-inch incision in your armpit to tenodese the biceps tendon. So good luck to you now. Bye-bye.